it's a workshop. We need quorum. We have quorum. So yes, you can get started.
Do we need a quorum for a word?
We have it. We have it.
No, I know. I was just curious. Do we? I didn't.
For workshop, yes. Well, no. For workshop, no. For workshop, no. As long as
I didn't.
As long as it's publicly advertised, the answer is no.
Okay. Yeah. I didn't think so. I just.
Mayor, do you want to get started? Mayor, I believe you're muted. Mayor, you're still muted.
You hear me now? Yep. Well, just to get started, as everyone knows, the town manager and staff has been working extremely hard to find us a more reasonable health insurance. Our insurance costs went up substantially this year, and due to everything that's going on in the world, I think next year we could even see a larger increase. So being financially prudent, the town staff has been aggressively searching for an insurance plan that will still serve the employees of Town and Golden Beach, but at the same time not increase our insurance costs by $180,000. He and I have had several meetings reviewing the plans, kept bringing them to me. I kept turning them down because, again, I know how important insurance is to the employees and to the families of the employees. So it's imperative that we have good coverage for everybody. So God forbid, if something does happen, it does not affect you financially. So I think that what the town manager is going to present this morning is some good options. And I hope everyone appreciates his hard labor and likes the options. Again, with insurance, we're not going to please everybody, just so everyone knows. There's no way in the world everyone's doctor is going to be on the plan. So what's important is, if you're not on the plan, what's your maximum out of pocket personally and as for a family. So I think he's done a good job to cover that. So with that, enough said, I'm going to turn it over to Town Manager Alex Diaz.
Mayor, and I'll try to keep my presentation somewhat brief so that the council and the members of the plan can ask as many questions as possible. Let me say this, from a personal perspective, I would like nothing more than for the town to keep United Healthcare to the League of Cities, especially since just late yesterday afternoon, I was diagnosed with a new health issue that has me worried about what's going to be my impact next year. And I think that we've been very fortunate to have a very rich Cadillac plan with United Healthcare. Unfortunately, my role as a city manager is not to look out for what's best for me, but what's best for all of our members and all of our community. And so early this year, the mayor and I both, well, the mayor serves and I participate in the Florida League of Cities, Florida Municipal Insurance Trust. In March, we learned that at a minimum, this year's rate, we're going to grow by 8%. By May, we decided to start looking for agents of record to help us shop around for new plans. And then in August, we got our renewal rates, and our renewal rates came in at 13.80. Let's call it what it is, a 14% increase to our current rates, a $111,000 increase to what we're currently paying today. The agent of record that we selected was tasked with going out and getting multiple plans by multiple carriers. Carriers tend not to quote rates until closer to your renewal. Our renewal is October 1. The Florida League of Cities gave us our renewal rates the 1st of August, and so we've been working with that. That agent of record provided us Blue Cross and Blue Shield as an option. Blue Cross and Blue Shield did not Blue Cross and Blue Shield gave a significant savings, but Blue Cross and Blue Shield is not currently being accepted by Memorial Hospital Network. Memorial Hospital Network services over 80% of our members. 80% of our members live in Broward County or Northeast State. So we had to disqualify Blue Cross and Blue Shield from being consideration. Aetna and Cigna decided not to quote the town of Golden Beach. At that point, I then decided to reach out to another broker to try to see if they can create a plan that is beneficial to both our members, that yields a potential savings to the town, or at least makes us break even. Understanding the disruption that switching plans can cause to our members, we asked all of our members to provide us with a list of doctors that they currently use to see what the disruption rate is. There are a few members whose primary care physicians do not take our plan. So we needed to create something for those members. And so what we decided to do for members whose doctors, whose primary care physicians do not take AvMed, what could we do to help with those out of pockets? I had staff members and myself call all of our doctors. What we found is that the maximum that a primary care physician charges for an office visit is $250. Most of us only see our doctors twice a year. Worst case scenario, 4 times a year. You have to get blood work every 3 months. So under $250, we're looking at an out-of-pocket cost for a member of $1,000. So we had to keep that in the back of our minds. Even if our doctors aren't in the network that we're proposing, typically what you go to your primary care physician for is to get lab work and other exams. And so all of that is covered through the AvMed plan. So what we presented to you last night, and we're going to switch out the buy-up option. And we're going to share that with you on the screen, because when the buy-up option was presented last night, it was still the risk for my members was still too burdensome. So late throughout the night, I've been working with the insurance broker that we're asking to present their plan today. We were able to find a buy-up option that would cost our members no more than what they're currently paying this year for the buy-up, and still achieve the buy-up objectives that the town council would like to see. Your choice your direction to me today is vital. If the council wishes for us to renew with United, we will do so. If the council wishes for us to take a look at getting better plan options through AvMed, we will do so. The purpose of today's workshop is for you to give me directions in terms of what you're leaning. Knowing that if there is an option with United, right? That there is an option with United that will allow us to stay net neutral on our costs. However, the deductibles and the out-of-pockets far exceed what's being presented today. So if your direction is stay with United, but change the plan, we can do that. But your out-of-pocket deductibles and your out-of-pocket limits exceeds what we're presenting today, which is why we're recommending that we switch. But throughout the course of the last 5 years, during the insurance renewals, I've told the members that we have a rich plan and that this day was coming. That the day would come where the town would no longer be able to offer its members a Cadillac plan, and we would have to look at our options. So rather than drag this out, what I'd like for Juan to do is explain to you the 2 plans that we're proposing. By the way, the second plan is not in your packet. I'm going to have those delivered to you later today. 4 of our members choose the second plan. 49 members choose the standard plan. So we're going to spend some time on the standard plan, which is 49 of the 53 members. And then we'll talk about the buy-up option for those individuals who feel like they need to have a rich out-of-network program. So with that said, Juan, introduce yourself, the companies that you work for, and why you've chosen to offer or proffer this plan for us today.
Good morning to everybody. My name is Juan Berenguer. I've been in the insurance business for over 30 years. My company is part of Acrisure. Acrisure is the fastest growing insurance broker in the world. It's a $2 billion company. Our agency is either the top producer or top 3 producer for Advent Health Plans. We're also in top producers for all the insurance carriers, United, Aetna, Cigna. So the Berenguer name is a name that is well known within the insurance industry. With that said, Alex, are you going to be putting up the benefits on the Zoom?
I am. Give me just 1 second. And council members and members online. So it's the PowerPoint that was emailed to everyone yesterday. Plan 1 for plan 2, the switch that we did is a different plan 2. So we're going to go to Zoom. We're going to go to share my screen. Share my screen. Give me a second.
If you prefer, you can make me the presenter, and I can show it on
Let's say, can you do that?
whatever.
Yeah, this is the one you, the email I just received?
Yes.
Okay, give me 1 moment. Can everyone see it?
Yes.
Okay.
Actually, no.
No, Lisette. Just give Juan controls.
Okay.
Exit out of your screen and give Juan controls.
Okay.
Alex,
Yes,
while they're doing that, can I ask a question? Because I hear numbers being given about, and I really don't know where we're, and I asked Lisette for these yesterday. Is there somewhere a spreadsheet showing what we paid United Healthcare last year?
Yes.
What, and if I already have it, then that's great. I mean, if it's part of the budget or someplace, if you could point me to where to look for it, I'd be happy to do it.
It's on page 3 of the presentation that was delivered to your home yesterday, and it's page 3 of the PDF that was sent to you last night.
Okay, so I do not believe I got a PowerPoint presentation.
Everyone did. It's a PDF presentation, not PowerPoint.
Oh, a PDF presentation. Let me just go to that. Hold on.
Juan, start putting up your share screen with the PDFs, the PowerPoint. Just give him the control.
I gave him controls. You should be able.
I have it up right now. Can you see my screen?
Yeah. Councilman Einstein, so the PowerPoint that you were, or the PDF, excuse me, that you received last night?
I've got 4 different items. Which one should I look at?
So the
Five different items.
So
And I received hard copies yesterday afternoon. So I'm a little bit all over the place.
well, I'm sorry that for that. So if you're gonna look at the, let me see.
Here it is.
You can see it now? Okay.
It's, so Councilman Einstein, the PDF looks like this. What's on your screen now?
Wait, so we're on a different, oh, wait a minute.
Alex, we're going to go over that right now, right?
Yes, we are.
Yes.
Okay, so let's begin.
Juan, I went ahead and shared it. So just let me know where you want me to flip to.
Okay, so, all right, so let me just go back to, let me go back to putting you on,
Go to page 3, Lisa.
3, you got it.
Okay, so Vice Mayor Einstein, if you look at the bottom of page 3 on both the printed version that we sent you and the PDF that was emailed to you last night, on the left-hand side, you see the.
Wait. Just a second. Page 3 of, we're on page 3 on our screen right now. Is that a different page 3?
No, it's the page 3 that was delivered to you last night via PDF and in printed format.
Okay, yes, I have that. So I'm looking at this on the screen, the main screen, the Zoom screen, correct?
That's correct. If you look at the left-hand side, it shows our current EHC Choice Plan 3, $61,000 a month, and our renewal at $70,000 a month.
Okay, thank you.
Okay, and then so those you're asking what our current costs are. So those are our monthly current costs
Got it.
for UCH Plan 3. 49 of our members are on Plan 3. 4 of our members are on Plan 1. So when we go to Plan 1, you take the Plan 3 totals and the Plan 1 totals. It gives us our monthly costs and then our annual costs.
Oh, wait, you got to help me with that now. The plan, I see Plan 3 there.
Alex, sorry to interrupt, Ben. If Juan's going to go over this, can we all go over it together? Because we're already 25 minutes in and we haven't really started.
I believe that's what we're doing, aren't we?
This is it? We're starting now?
Yeah.
Juan's not going to talk about benefits or anything like that?
Yeah, we're gonna get there, I guess. Yeah, Vice Mayor Einstein, does that answer what our obligations are for you on a monthly and annual basis?
That's currently we're paying $70,000. We're going to paying $61,000 formally, and now the rate increase is $70,000. Is that correct?
1,000 a person.
It's $70,000 for the correct. Our renewal rate is $70,000 per month.
Mm-hmm.
Okay, got it.
All right, Juan, let's go ahead and talk about plan comparisons. Current Plan 3 is the proposed AdMed Achieve 7419.
okay, so on your far left corner, you have your services, starting off with calendar year deductible. Next is copay coinsurance max, which is your out-of-pocket maximum. So if we go horizontally across, the first section has the first column going downwards is your current benefits. The second column compares the first and the last columns. Okay, so right off the bat, so why don't we start off with calendar year deductible? Your current calendar year deductible is $500. Family is $1,000. Okay, and your out-of-network deductible is $1,000 and $2,000. If we go to the far right, AdMed Plan 7419, you have a $5,000 deductible with a $10,000 family. Okay. Now, the beautiful thing about this program is that instead of you having to pay
Juan, you're breaking up.
as you are right now.
Juan, you're breaking up. Juan, you're breaking
up.
up. You're breaking up. We can't hear you.
Okay.
You're breaking up.
Okay. Is it better now?
Yes.
Okay. So with the AvMed plan, deductible is $5,000. Nonetheless, Transamerica pays the first $7,000 towards inpatient and outpatient services. So the benefit here is that on your current plan, you would have to pay the first $500 in the event of a hospitalization or a surgery. Under our plan, you would pay $0 on deductible. And on out-of-pocket maximum, the first 7,000 is covered by the gap, and then the HRA, you have an additional 1,800 on the HRA. So your total out-of-pocket max on a surgery or hospitalization under the recommended plan would be 0. That's why in the center, you have Advantage. It says AvMed plus HRA plus Transamerica equals a 0 worst case scenario versus under your current plan, you would have to pay in the event of a hospitalization $2,500. So obviously 0 versus $2,500 is superior for AvMed combination. So I just explained the hospital. So on the hospital, under your current plan, you would have to pay the first 500, then you pay 10% up to your out-of-pocket maximum, which is $2,500. So if you're in the hospital for a couple of days, 3 days, chances of you having to pay $2,500 are 90% or more. Under the AvMed plan, all your expenses for the hospital are going to be covered by Transamerica and your HRA, so you would end up paying 0. Now, let me explain something to you.
Oh, excuse me, you use this HRA acronym? What is that?
Reimbursement accounts.
A what?
A health reimbursement account.
Health,
Juan,
you would have a, Mhm.
Juan, you're still breaking up pretty bad. Are you using your audio over internet?
I am.
Can you call on your cell phone so we can hear you a little bit better?
I sure can. What's that? What's the number I call so I don't even have to look it up?
The phone
Juan,
number?
do you have the number? Good. It should be 929
Yes.
205 6099.
I'm looking up the phone number.
I'm giving it to you, Juan.
Okay, what is it?
929 205 6099. And then the meeting ID, you're going to have to write this down as well, is 817 02 59 40 94.
Okay, thank you.
Does he need a password?
It didn't require the password.
Okay.
What?
What is the meeting password?
Hold on, I'm getting that right
It
now. I'm
should
sorry.
be
89
89
33 33.
Correct.
89 what?
33.
Okay, you guys spoke to Oliver at the same time. 89.
3333.
Alex,
Yes?
while this is going on, in terms of the timeline on voting on this and everything else, what is our, tell me about that. I know October 1st is a deadline, but tell me what.
So here's the issue with insurance, right? Our renewal date is October 1, and we're
Correct.
required to have everyone enrolled after we make a decision as to who we're going to go with. And there's no changing that time frame, right? So we couldn't have started earlier because we don't get our renewal rates until August.
No, I understand that. I understand all that.
So the goal was that today the council would give me direction as to how it felt about the options that we're presenting, so that at the September 22nd meeting, you ratify your decision based on the straw vote that you're going to be taking today.
Oh, we're doing a straw vote today?
I need to get a feeling as to how you stand, because remember, I have to get everyone enrolled by the 1st.
Excuse me for a second. The meeting password that I was given, 89333, is telling me that it's invalid. So somebody please.
893333.
893333. Okay, so that's the 3. Okay, thank you.
Who muted us? Lisette,
Yes, sir.
if somebody mutes us, just kick them off the call.
Okay.
Enter your meeting ID followed by #.
Yes, I know you have to get off at 10. I don't know what you guys want me to do.
Enter your participant ID followed by, please enter the meeting password followed by.
Can you guys hear me?
Yes, yes.
Yes.
Okay. Oh, okay. Okay. All right. So.
Juan, you have to turn off the volume on your computer.
All right. You guys can hear me now?
Perfect. Thank you. Let's go.
Okay. So we were in the section over here where it says hospital. Okay. So currently in your current plan right now under hospital, you would have to pay the first $500, then you pay 10%, okay? And the 10% is capped when your calendar year deductible and the 10% equal $2,500. So your chances of spending $2,500 on a hospitalization are very, very, very great. Under the plan that's being proposed, the calendar year deductible plus 50% is what the cost of the hospitalization. Nonetheless, the Transamerica plan is going to pay the first $7,000. So that would leave you a balance of $1,100, which could be paid by the HRA if the member chooses to. Now, so if the Transamerica pays the first $7,000 and the HRA pays the next $1,100, you've met your out-of-pocket maximum of $8,100. That means that from that moment forward, for the rest of the calendar year, you have 100% coverage, no more expenses. So that means that after that hospitalization, if you go see a doctor, you're no longer paying $30. It's covered at 100%. If you need to have prescription drugs, there's no cost. It's covered at 100%. Now, the next line item on the first column underneath hospital services is outpatient services. The same thing applies. Under your current plan, your labs are covered under 100%. They are also covered under 100% under the proposed plan. Your surgeries and your MRIs and major diagnostic services, the member has to pay the first $500, then 10%. Under our plan, the Transamerica plan coverage pays the first $700, and you have the HRA to pay the next $1,800 up to $1,800. If you have a surgery that costs $9,000, $7,000 would be paid by Transamerica. The HRA would pay the next $1,100. You've met your out-of-pocket maximum of $8,100, and your benefits are covered at 100% for the balance of the year. Next line item, urgent care. Urgent care, currently, you pay $50. Under the Transamerica plan, it's also under the AvMed plan, it's also $50. However, Transamerica pays 100% of that $50. So your members would have urgent cares covered at 100%. Emergency rooms, currently you're paying $150. Okay. Our plan is calendar year deductible plus 50%. Now, what I've done is in the center where it says Advantage, I've put over here AvMed, Transamerica, 100% covered, and then I put True ER only. So let me explain to you what a True ER is. Is a chest pain, a deep cut, not being able to breathe. If you go to an emergency room for a cold, it's not going to be covered by Transamerica. That's what urgent care is for. If you have a cold or something that is not life or limb threatening, then your choices are to go to CVS Minute Clinic or go to any urgent care in the plan, and it'd be covered at 100%. The next line items are primary care physician and specialists. The co-payments are $30 and $60.
So
You
can
have
I
an
ask,
HRA. Sure.
on the urgent care, just real quickly, or emergency, I think it's emergency room. Okay, yes. So if someone has kidney stones, that's not life-threatening. You could get there and Transamerica says, well, you know what? This isn't life-threatening. We're not covering it. You know, let me tell you, if you have kidney stones, you think you're going to die.
My friend, that would be, I've had that with prior clients, and
Yes.
Transamerica has paid for kidney stones.
Was it
that
an
is
ar-
considered a true emergency.
Was
It's
it an
life or limb threatening. Kidney stones is limb threatening.
okay?
Okay, now a headache or a cold is not life or limb threatening. So there's a distinction. So if you have a corneal abrasion or you have a kidney stone, things of that nature, those are true emergencies. And anything that for an accident, you know, that an ambulance takes you to the emergency room, it's going to be considered an emergency room. Now, when we go to the next three items, which is primary care, specialist, and RX, you have an HRA, Health Reimbursement Account, Visa debit card. And that debit card will pay up to the first $1,800 or whatever amount the town of Golden Beach chooses to put in that HRA account. So that is, so you can't beat 100% because the HRA, you know, you would have to have a lot of doctor visits, multiple doctor visits a day in order for you to reach $1,800. Now, so the plan, when you look at line item by line item, the AvMed, Transamerica plus Health, the HRA, has a 9-0 advantage over your current benefits. Okay, so nothing can beat no charge. And that's what, and not only are the benefits significantly better because 100% coverage, but your cost would be reduced by an average of 30%. That's huge. That's would be your savings. So I'd like to open it up for questions. Or anybody have any questions on the HMO, please?
Yes. I'm Bernard Einstein. Going back to your Transamerica on the urgent care, you say members' worst case scenario on the emergency room. Just throwing this out there to you. You know, somebody has an emergency situation. It's a gray area. Not sure if it's emergency, but you know what? For this particular person, the headache was bad enough. He went to the emergency room. He made a call, said, "I'm going to take a risk. I'm not fooling around with this." Goes to the emergency room, and Transamerica comes back and says, "You know what? This is not covered. We are not covering this." And the hospital says, "Hey, you owe us $7,000 for this emergency room visit." So worst case scenario for that person, if Transamerica doesn't cover it, is how much?
Well, if Transamerica doesn't cover it, then your out of pocket is $8,100.
I mean, that's a potential. Yes.
Okay, so you know but wait a minute, guys. That's with any insurance, whether we this or even if we were with United. If United didn't cover it, you're still out of pocket. We didn't have the Transamerica.
That's correct. But with United, take a look at what your out of pocket is, Glenn.
Okay, now let me
look at your risk. Look at your risk with United.
So
out of pocket is $10,000.
Doesn't want to go to urgent care.
No, that's copay, Glenn. That's not out of pocket. That's copay.
No, I'm looking. What's your out of pocket plan? Guys, hold on. Let me talk one at a time. Yeah. It says our old plan. What is the out of pocket limit for the plan? Network 2,500, 5,000 family. Non-network 5,000 individual, 10,000 family. So if that wasn't covered, you'd have the same scenario. I'm just pointing out, Ben. I'm just No,
it's not the same scenario. One is 2,500. And one is 8,100, and one is 5,000. Is the 16.2 for out of network? I don't even know if that's out of network or for because there's.
If you guys would be so kind and allow me to clarify this a little better for you, okay? Under your current United plan, a member goes to the emergency room for a cold. Okay, and United Healthcare doesn't consider it an emergency room. You have no coverage from United Healthcare. You're responsible for paying the whole entire emergency room. There's no coverage in or out of network.
Correct. That's if you went to a non-emergency room. But if you went to Memorial Hospital's emergency room,
if you go to any there is no in or out of network for emergency rooms. All emergency rooms in the United States are covered. In fact, all emergency rooms worldwide are covered under both plans. What was explained was if you go to an emergency room and United Healthcare does not consider it an emergency room, they are not providing any coverage whatsoever. You're on your own on that emergency room.
But they're not delineating whether or not it was an emergency, correct?
They're making that decision.
They're not making, United Healthcare isn't saying, oh, he had a headache. He went to an emergency room. Let's say he goes to.
Of course they do. I've had members under United Healthcare that have gone to the doctor to an emergency, and it wasn't an emergency room, and the member we've been fighting to get that claim covered because United Healthcare doesn't want to pay.
Now, when you say it wasn't an emergency room, are you saying if somebody goes to Aventura Hospital, okay, he has a bad headache. My understanding under United Healthcare, it's $150 maximum in and out of network. Is that correct?
Okay, now what the United Healthcare is going to determine whether that was an eligible emergency room. Chances are they will consider an eligible emergency room. Now, the difference is that under the AvMed plan, if you go for a headache and it's coded that you went for a headache, it's going to be covered by AvMed. The one that's not going to cover it is Transamerica. So now, with that situation, that's why we're offering a buy-up option. If you don't want to deal with this Transamerica having to pay the first $7,000, there's a buy-up option that wouldn't have that concern. Now, for all I'm explaining is the HMO benefits. So now these are the point of service benefits. If you look at emergency room over here, okay, this has the wrong emergency room benefits. Can you go all the way down to the, can you skim all the way down until you get to the summary of benefit and coverage?
Sure. Sure.
It's page.
Okay, this is the summary. Keep on going. More. Keep on going. Okay, keep on going. Okay, now keep on going. One more. Down one more. Okay, so now here, keep on until we see emergency room.
There it is.
That's it.
All right,
right there.
where it is. It's $250. That would be the same. That would be your exposure under this plan. $250.
When you say this plan,
That's the buy-up plan.
the what? The buy-up plan?
The buy-up plan.
This is the buy-up plan. So if you don't want the concern of Transamerica paying or not, under this plan, your maximum exposure at that Aventura Hospital would have been $250. Now, if you went to Aventura Hospital and it was for kidney stones, that $250 would be paid by Transamerica, because this option also includes a Transamerica. So I apologize, we modified the benefits early this morning and it was left incorrectly in the prior sheet. So that's your co-payment, would be $250. And we'll correct this and resend it to you.
Can I ask a
Okay,
question?
Sure.
If someone goes to an ER and they have chest pain or a headache like Ben had described, and the ER physician feels that they have to look further because of safety's sake, and it does look like it could be a pending serious issue. And after all the tests, it does turn out to be nothing serious at all, and the patient goes home. In all likelihood, they're still going to get stuck for the money because nothing was found wrong, and what could have been something serious was.
Well, that would not be a true statement, because if you went to the hospital for chest pains, okay, that is considered a true, and then they find out that it wasn't heart related, that it was digestive related, you know, we are not physicians ourselves. Now, chest pains are considered true emergency room. What's not considered an emergency room would be a cold, okay, or a minor headache. And if anyone has any concerns about the Transamerica covering for the emergency room, then they should go on the buy-up plan where it only have an exposure of $250.
Okay.
Okay, now if you know, who wants to go to an emergency room and wait hours and hours with all these kind of patients with all these kinds of illnesses that you can pick up? We have great urgent cares in the network. You can go to a Baptist urgent care and you're going to be treated much better than you are in a hospital room. So if anybody that looks at this situation from a logical point of view would prefer to go to an urgent care than an emergency room. Now, if it's life or limb threatening, please just call 911 and have them take you to the hospital. Don't deal with where should I go or where shouldn't I go. And if it's an accident related, of course it's going to be covered, any emergency room. Okay, what's not going to be covered is things that any cognitive person knows is not a true emergency.
In terms of rates, just so I understand, with the step-up rate or for the higher rate on this plan, which plan should I be looking at to compare?
You don't have it. You don't have it. Like I mentioned to you on the call earlier this morning, and as I mentioned when we started this workshop late last night, in the interest of trying to find a plan that provides greater coverage for those 4 members who wish to do the buy-up. We provided, we're going to show you on the screen. Lisette, go to, is this plan 2 on the screen? Or plan 1, sorry?
Yes.
This is the buy-up, yes.
Okay. It's what's on the screen now. And the police is delivering to you a printed version to your homes if you're an elected official, staff. It's available at the front.
So what is, can you tell me what the buy-up is, Alex, in dollars?
Sure. So if you choose to do the buy-up, it's your cost to our members. And by the way, we didn't talk about Plan 3 cost to members, and we'll go back to that. But if you look at the renewal rates, right, they're less than our Plan 1 today for the premium costs. So there would be no increase in terms of premium costs. And if you wanted to have the Transamerica and the $1,800, the difference is, Maria, where is that sheet? The difference is de minimis, and the town would cover that. Yes. The difference is, give me a second. Maria, bring me that sheet, please.
I believe it's on the screen. I believe I put it on the screen.
No.
That's not it? Okay.
Alex, also while we're doing this, originally the
I'm listening.
The HRA card was $1,000. I heard thrown around.
Has that
changed?
So the increase to for those employees who choose to stay on Plan 1 or the new Plan 1, it's a $50 increase for employee. It's to basically no more than $200, and the town would provide that premium benefit.
Wait, what are we talking? I'm sorry.
So there's only 4 members that currently this affects, if they choose to go to the buy-up option. And so the town would explore to offset those premium costs. We would offset those premium costs through the HRA. We have to design that. We haven't designed that. The goal was to give those 4 members who want a buy-up option a plan that's comparable to our plan one today with the least impact possible on the premium cost. There's a way for us to defray the premium costs by looking at the contribution that we make to the HRA.
Alex, the HRA on this thing says $1,800.
That's correct.
The other day, you had mentioned everybody's going to be getting a debit card called a $1,000. Now I'm understanding there's an I think an acronym is the HRA.
That's correct.
Has that changed from 1,000 to 1,800?
So I haven't provided anything to anyone but 1,000. So I had mentioned over the council meeting that we were looking at a range from 1,000 and it could go up to 5,000. We've settled on $1,800. By the way, whatever isn't used by the member rolls back to the town. But right now, I'm leaning towards an $1,800 allocation per member for their out-of-pocket costs.
Okay, just wanted to clarify that. Thank you.
Yes, yes.
And that has nothing to do with the money for the gap.
That has nothing to do with GAP, correct?
Can I ask a question about Transamerica?
Sure.
I got a list of doctors that evidently AvMed purportedly covers. In terms of Transamerica, is that a separate set of questions to ask for those doctors?
Transamerica is going to cover your big ticket items, surgeries, MRIs, emergency room, urgent care, anything that is inpatient or outpatient related, like a surgery. The HRA is to cover your doctor visits and your prescription drugs.
So tell me,
everything.
Tell me how this works. I walk into the hospital and I hand them my United Healthcare, my AvMed card. I give them my Transamerica card. They look at it and they say, well, what's this?
Yeah, what you do is if you go to a hospital, you can give them all 3 cards.
And they look at my Transamerica card and they say, what's this?
No, they don't. That's not true.
They're not going to do that. They're going to say,
I'm asking this question. They might say, well, we don't accept this. We don't process this. You have to process this on your own.
Yeah,
I don't know. That's a question I have.
Do we pay the hospital, or AvMed pays us back?
Or Transamerica?
Or Transamerica?
Okay, all right. So the way that Transamerica works is the same as United. When you go to United Healthcare, when you go to a hospital under United Healthcare, Aventura Hospital is agreeing to receive payment from United Healthcare for services rendered to the member. The same thing happens with Transamerica. The Aventura Hospital agrees to receive payment from Transamerica for services rendered to the member. That right there is known as assignment. And the hospital would much rather collect the funds from Transamerica, which has been around for 200 years, it's an A-rated carrier, than from Juan Beringer that they've never heard from before. So assignment at a hospital is not going to be an issue. Companies that you're not a guinea pig under this plan. City of Miami Police Department, with over 1,700 active police officers, uses the same concept. Coral Gables Police uses the same concept. Hilton Hotel in Miami downtown Hilton uses the same concept. So you're not going to have an issue with a hospital. Now, if you go to Rodriguez Diagnostic Services, they might give you an issue accepting Transamerica. But if you go to a hospital for an MRI, or you go to a diagnostic facility, most of them all accept Transamerica. And by the way, the AvMed plan also includes a program called Smart Shopper. And what Smart Shopper does is it recommends facilities for you to go to. So let's look at it from this point of view. The member needs to have an MRI done. The cost of the MRI is $1,000. The member calls up Smart Shopper to get a list of what providers they're recommending. They go to a Smart Shopper provider. The $1,000 is paid by Transamerica, plus the member will receive a check anywhere from $50 to $200 for making a smart decision. So this program is
Juan, let's not spend more time on that. So
Alex, can I just throw something out?
Absolutely, sir. The meeting is for you.
He mentioned really quickly, and I guess it's important to him, he said Transamerica has been around for a long time, and it's an A-rated company, okay? And I guess that's very important in the insurance industry when they mention that. Now, in my research, when I went across the board and I was looking up AvMed, you know, they've got less than stellar credit rating with AM Best. I mean, they've gone from poor to stable. Their financial records don't really look good. And that really bothers me. I wonder how Mr. Beranger feels about that, since he has mentioned how good a financial statement Transamerica has. I'm a little concerned, you know.
Okay, so what I will do is that number one is the state of Florida employees are under AvMed. Miami-Dade County is under AvMed. Jackson Memorial Hospital is under AvMed. I sent Alex Diaz a financial disclosure from AvMed
I shared
on
that
how
with the vice
strong their
mayor.
financials are. So, Mr. Einstein, I would urge Alex to send you the financials so you can be satisfied with.
He did receive it. That was shared with him yesterday.
And so, how do the financials compare to United Healthcare?
Well, number one is there. First of all insurance companies in the state of Florida are monitored by NCQA, and AvMed and United Healthcare are both monitored by NCQA, and they're both stable carriers under the state of Florida. So claims are being paid, and by the way, out of the last 20 years, AvMed has been rated number 1 by J.D. Power and Associates in member satisfaction.
J.D. Power, I don't pay any attention to at all.
Okay, well, but
yeah, who has the higher rating, United Healthcare, by AM Best, or AvMed?
Okay, United Healthcare, you know that.
Okay, no, well, I'm just asking you as the insurance agent, because I'm not well versed.
You know that before you ask the question.
I'm just going online, and you know, I asked Alex because we got AvMed's partial client list. You know, with United Healthcare, they've got, and Alex quoted me, I don't know how many cities in the state of Florida right now are choosing to go with United Healthcare.
That's not true. Those cities, that's not what I said, sir, and I need to clear the record.
Then I stand corrected then. Whatever.
Those cities choose to use the Florida League of Cities as their agent of record, and the Florida League of City chooses United Healthcare. So that when you are a league member, you do not have a choice. So the league selects that for you.
Okay, but how many league members currently use United Healthcare?
We're getting you that number as we speak. Lisette is actually texting, as you can see, as we're trying to get you that information. There's over 400 league members who choose the league as their provider.
But how many municipalities?
There's 8,100 governmental entities in the state of Florida.
Okay. Is AvMed Florida only? Is AvMed Florida only?
The answer to that question is that if you select the buy-up option, you have access to while in an area that the AvMed network is present, you have AvMed and out of network. If you go to an area such as North Carolina that does not have an AvMed network, then the default, and as you can see on the very top of the spreadsheet over here, it says below AvMed, AvMed area, www.avmed.org, and then out of AvMed area, it says www.multiplan.com. And that multiplan is a national network available to you. And under that plan, when you go to a doctor at Duke University, okay, you pay $15 for a primary care and $30 for a specialist. So as far as coverage is concerned, this is a national coverage plan.
Okay.
Sir-
Another
Okay.
question. You commented that after the deductible is met, 100% is covered. Does that include out-of-network physicians?
Okay, when you meet your out-of-network, out-of-pocket, then that would include out-of-network physicians.
What is out-of-network?
Okay, so it says over here, if you look all the way down the first column, it says county your deductible first, then it says copay coinsurance max. If we go horizontally across, it tells you that your out-of-network, out-of-pocket is $10,500. So, and by the way, your Transamerica would pay, if you go have an MRI out-of-network, you have out-of-network coverage. That would be covered. The first $7,000 is covered by Transamerica of the usual and customary reimbursement for out-of-network.
I want to
But
comment.
then it says Transamerica pays first 100% up to $3,000. Am I looking at the wrong thing?
Oh, no, after the first 3,000, yes, that's correct. The first 3,000. 7,000 is at the HMO.
It doesn't pay the other thing. Can you just explain, and just because the nomenclature has changed, the tradition, in the old days, okay, an HMO, you went to an HMO, or when something said HMO on the policy, one would be led to believe, before I can go to a specialist, I have to go to a
PCP.
Primary care physician.
Before I can go to that. Now, I'm told that on your plan, the AvMed plan, it doesn't say point of service, it says HMO, but you can go to your specialist. Can you kind of elaborate on that a little bit?
I thank you very much for asking the question, Bernard. It's a great question. Your current plan, United Healthcare, only offers HMO coverage. The only give a point of service.
Wait. Our current plan only offers.
Yeah, they're HMOs. They're fall under HMOs. Yes.
Okay, but from a practical standpoint, the way I can go directly to my dermatologist under
you can do that under the AvMed plans as well.
Okay, so tell me about the HMO then. How did this change, or what happened?
Okay, all policies, 99% of all the policies issued through insurance in the state of Florida are HMO. Point of service is an HMO with an out-of-network benefit. It falls under the HMO regulation. There is only one carrier that offers a PPO, and that is Blue Cross Blue Shield. It's called Blue Options. United is offering you an HMO. You're covered under the HMO. AvMed is offering you an HMO. Now, option 1 with AvMed does not have out-of-network benefits. Option 2 with AvMed does have out-of-network benefits. So that's the only difference between option 1 and option 2 is that one has out-of-network and the other one doesn't. But they're all the policies that are on this sheet today that are being reviewed are HMO policies.
Juan, his question is that he doesn't need a referral to go see a specialist. He wants to know why he doesn't need. He wants to know why he doesn't need a referral versus other plans that require a referral.
Yes, thank you, Sid. the HMO and all the plans that are being explained, United and Avnet, have what is known as open access, that you can go to any doctor without a referral. Now, Bernard, that doesn't mean you can wake up one morning and say under your United plan, I want to go have an MRI. That will not be covered unless United Healthcare authorizes the MRI, and the same is true under Avnet. So authorizations for services are generally needed, but referral to see a specialist, no referrals are needed. I hope I've answered your question, Bernard.
While you're on the MRI situation, let's say Avnet says, you said your smart list or whatever for an MRI that we would like you, they have a contract with that particular MRI service or what negotiated rate, however they did it. And I recently went through this, and I went to United Healthcare. I needed an MRI, and I had a choice of going through a couple of MRI places, but my doctor wanted me to go to a specific machine. And he says, I need you to go here because the imaging there is the latest technology. It was like a 5K. I'm just going to use an example. There's some machines out there that are 4K, and there's some that are 5K. I don't know how that works, but under United Healthcare, they said, yeah, go ahead. You can go there. It's fine.
Bernard, the same thing happens with Avnet. Once the doctor issues the prescription, for an MRI, you can go to any MRI facility in the network. You can go to the hospital where the imaging is better at a Memorial Hospital or at a Holy Cross. You can certainly go there. Now, if you go to Smart Shopper, they are going to tell you, listen, if you go here, we're going to send you a monetary incentive. But you don't have to accept that. You can go to whatever facility you choose to or that your doctor recommends to get your MRI done, as long as it's in network. And if it's out of network, then out of network would apply.
But
so
if
no
the
one's
doctor,
restricting you.
but if the doctor writes the order for the MRI, whether it's here or there, it's guaranteed to be paid by Avmed, correct?
That's correct.
Well, up to their limitations for MRIs. You have to look at what they pay.
Okay, I have.
No,
go ahead. I'm sorry.
Okay, the way that, I'm sorry, let me explain. The one that approves all the services is Avnet. Once Avnet approves a service, Transamerica automatically pays. There's no question about whether it pays or not. Transamerica will pay 100% of your outpatient service, your diagnostic, your MRI, up to $7,000. So you don't pay anything for an MRI under this recommended plan.
But if the doctor writes the order for the MRI, it's guaranteed to be done. Avmed wouldn't turn around and say, we don't think it's medically necessary, would they?
Well, United can say, we don't think it's medically necessary, and United's not going to pay for it.
Well,
It's not, okay.
I don't want to say, never say never, but it's never happened. So I'm asking specifically about
Well,
Avmed.
for all those services that it's never happened, it would have never happened with Avnet. Now, I can assure you that I can provide you with data of many people that have wanted to have an MRI, and United Healthcare hasn't approved it.
One other comment. Obviously, many of us have a variety of different physicians. I called a physician this morning to find out if they accepted Avmed, and he didn't. But interestingly enough, they have tried several times to sign up with Avmed as early as last week, and Avmed denied them. And they've been a little upset by it, and Avmed's reasoning with them is, geographically, there's a lot of Avmed physicians in that particular area, so they wouldn't take them on. I found that somewhat disturbing
Okay, so
because
let
they're
me ask
trying
you
to
a
get on
question.
AvMed.
Okay, and I will help with that. We are the largest producer with them. We will help get that doctor in the plan. Now, what kind of doctor is it, please?
A
What kind of
PCP,
specialty?
general,
It's a PCP,
general,
okay.
general practice, family physician.
Okay. We will do our best to try to get them on the plan for you.
Okay. I'll
Juan,
get the information to you through Alex.
Juan,
Please.
I want to
Yes?
share this with you in terms of I happen to know a personal physician, and you know, I guess we all come up with our biases through time, and you know, you say, well, I kind of like this Ford more than, or I like this Cadillac more than I like this Ford or this Mercedes, da da da. We develop these likes. You know, you could have had one bad car and you'll never buy that make and model again because you feel like every one of them are bad. And I liken that example to situation to a physician I know who dealt with AdMed, and they had to get authorization to treat a patient. And this patient had a very serious condition. And AvMed said, we'll get back to you on that. And they got back to, AvMed got back to them sometime later. I mean, it was very, very, very difficult for them to have dealt with AvMed. And trust me, this person is a very sophisticated individual and physician. Told me about the situation so I could intercede and try to deal with AvMed. And AvMed basically dropped the ball on this and basically said, well, you know, we're going to give you authorization for one treatment every 2 weeks. That was their determination. And that took after a long time. So it was a very difficult dealing with them. And yesterday I spoke to someone, and I guess I think you're going to come up with, well, if you ever have that problem, Ben, you're going to call me up and I'll deal with it, you know. And I've been with United Healthcare for I don't know how many years so far. I get the feeling that it's got the power of the Florida League of Cities behind it, and they don't mess around. When I walk into the doctor, when I go anywhere with this United Healthcare card, I really don't have any problems. I'm not saying that that may not happen with AvMed also, but you get this feeling from the community and from other people concerning AvMed that their reputation is not as stellar as United Healthcare. I mean, you can put on paper whatever you want here now in terms of whatever happens. But when someone has to go to MD Anderson, and let's say they opted up for this higher plan, and you say, well, you have to go to your out of AvMed area network or whatever, multiplan.com web center /portal. And you go in there and it says, MD Anderson, you can do this, you can't do that. You're going to get up to we're going to pay the first 100% up to $3,000. Whereas with United Healthcare, if I need to go to Mayo Clinic or one of our people I looked at one of your exclusions, I think, and so does United Healthcare. They have exclusions for everything, I think, except for a bone marrow. You know, I don't know about heart transplants and things like that. But, you know, those are my concerns on the really big ticket items. You know, if I come out $2,500 or a plan member comes out $2,500, that's fine. Oh, by the way, on United Healthcare, Alex, I've never asked this question. Is a Transamerica Gap available also?
Yes.
It is.
Yes.
And is that something that has to be done across the board, or could it
Yes.
be done individual by individual?
No. All
Okay, so,
all members in the group. And we've explored that for United Healthcare.
okay, so you could do a Transamerica gap if we raise our deductible. If that was one of the options
So
we did.
Councilmember Einstein and Vice Mayor Einstein, excuse me. Vice Mayor.
You call me Ben.
No, sir. So in the interest of full explanation to all of the members, and I thank the staff for listening in today. So we did look at a way to stay with United Healthcare by raising our deductibles and increasing our gap, and providing a gap. That option does not yield a savings to the plan, and it increases the premiums for our members. Under the AdMed option, our members overall will see a savings to them on a monthly and annual basis, and in some cases, that saving is extremely significant from a premium perspective. So our members today would see a premium savings, an $1,800 cash allowance to them. If we were to stay with United and offer a higher deductible with a gap, our members would be out of pocket. That's why I chose not to go that route with United as one of the recommendations. The council can clearly impose that we go that route using United with a higher deductible and a gap and increase the out-of-pocket cost to all of our members. That's definitely in your purview. My job as a city manager is to give you recommendations and options for you to choose from.
Can we go to the first page again where it compares the two? The page I'm on right now is with the step up. No, not that.
One down.
This is, yeah. The renewal is current is 70,000 and with you, you know what, you got your little phone thing there. Can that move a little bit to the left or the right? Or I'll go to my list. I'm sorry. So you're $50,000 a year.
Yeah, the savings are about 300,000 plus. For significantly better benefits.
Juan, that's not true. There are savings. The savings yield will be dependent on how much of the $1,800 that we give to the members isn't utilized. So let Juan, when it comes to numbers, because my council needs to understand, and so do my members. So I'll speak as to numbers because I understand that you're trying to make it seem very rich, but I have to speak in what is the worst case scenario. So let me deal with the number part, please.
May I say something while we're in pause here?
Sure.
Hi, Council. This is David Carazana, the president of the union. And I've been looking at, I looked over the proposals, and I want to let you know that I came from Coral Gables. And while at Coral Gables, I helped manage the health trust plan. While there, we were in a big problem. Basically, what the city's looking at now, we had to make some hard choices. We got this same consultant to come and help us. We were in the red by close to a $750,000. And Juan was able to get us out of that. And we went to AvMed, and our benefits within AvMed, I think in some cases excelled what we used to have. And sometimes there was at some point, you may have to find a different doctor because it's not within our health plan. But I think we achieved probably a 95, 99% ability to keep the same doctors that we had. And in most cases, our benefits were actually, I went better from our previous provider to AvMed. So I'd just like to make that comment. that what I'm looking
Who
at
was your-
here
who
seems
was
like
your
a very
previous-
good proposal.
Who was your previous provider, by the way?
I can't remember, and Juan may be able to, he may remember because he's the one that helped us out with that.
Hey, guys,
Yeah, that's
I got
it. It was,
to, guys,
it was,
guys, I got to intervene a second. Thank you. I appreciate that, David. But remember, as I said from the beginning, there's no way we're going to please everybody, but you got to look at the town as a whole. The town as a whole, we have to do what's fiduciary responsible. And the insurance, I think the town manager has done a great job providing the gap insurance and the Transamerican insurance to cover any excess costs that we might incur, but at the same time, not increase any expenses for the town of Golden Beach, guys. So it's not just about us as individuals, it's about the town as a whole. And you got to remember that, okay? You've got 390 homes, you know, almost 1,500 people living here. It affects everybody. So I think, you know, we could go on and we could dissect this case by case. But overall, I've been listening to this for an hour and a half, and I went through this before. I think overall, I think it covers our needs. I think it covers the employees' needs. And remember, we have to do what's best for the town, guys, okay? It's not just about individuals. So with that said, I mean, unless there's any major questions, because we could keep doing this for another hour and a half, all right? I think we need to take a straw vote to see if this is acceptable to everybody, correct?
Mayor, before you do that, because I have on the line, I have 18 of our staff members on. I just want to explain something to them real quick, because this affects the majority of the members of our staff members. Staff members, as it relates to whether or not you have, let's say, an employee. Let's assume that you choose to stay in the plan one, which is what I strongly recommend for all of you, right? And not do the buyout. And let's say worst case scenario, your primary care physician isn't on the list. So worst case scenario for a primary care physician doctor visit, we're talking about $350. So we've been calling those that don't take AdMed, right? Given your premium savings and the $1,800, you can still see your doctor and you're not going to pay a dime. So see me one-on-one to explain to you how that happens. So I wanted to make sure that the members, our staff members, realize the benefit that you're getting from the premium savings and the $1,800 that we're going to give to you. So don't think that you're going to be paying out of pocket, because you will not be. And there's only 3 members whose primary care isn't an AdMed recipient. Thank you, sir. I'm sorry for that.
Mayor, I'd like to say to you, by the way, since I've been on council, I've always taken the best interests of the town and the employees in making a decision in whatever healthcare insurance we've used. In terms of looking at, you know, cost being one of the criteria in doing it. But on top of that, I also look at what I believe to be the better company. Okay. That also, what I think is going to be the best for either the council, in making their decision for the community, for the workers overall. And, you know, you have to base your decision just that, not on just dollars and cents.
I totally agree, okay? But if you look at the comparison, and we've been listening to it for an hour and a half, yeah, there's some pros and there's some cons.
Yep.
But overall, I think AdMed's a solid company. And as David attested to, you know, Coral Gables used them. Other cities have used them. I checked with some doctors of mine. Majority of it takes it and some don't. If they don't take it, you go to out-of-network and you use the gap insurance to pay the difference. But, you know, I think overall for the employees as a whole, for the town, I think this is a good, solid plan. Okay.
So,
and again, it's not life. It's for a year. And God forbid, if the plan does not work out next year, we'll look at it and we'll reevaluate the situation. And if we've got to change, we got to change. But the fact is, health costs are going up. Next year, I'm expecting a huge increase, as I'm sure everybody is, okay? And we've got to do what's best for, yes, Ben, you're right, the employees and the town as a whole, okay? So with that, I'd like to ask any of the employees online, because I know, as the town manager said, there's a lot of employees online. If anyone would like to say something, not the council, the employees, or any concerns, can you please speak up and so we can address your concerns?
Lisette, can you change the screen so we can get the bigger screen back up, the grid screen? If we don't need this
Yes, of course.
visual. I'm
So
serious,
Lisette,
sorry.
can you
Is that all right, Mayor? I'm sorry. Or
Yeah,
everyone
that's
see the-
fine.
Can you see
Okay.
the screen, the grid now? I did change it.
the grid is up.
Mayor,
Lisette, can you unmute
And thank you,
everybody?
Mr. Juan, thank you very much for your presentation this morning.
Mayor,
Yes,
it's Linda.
Thank you.
yes, Linda.
So the plan seems optimal to health concerns, at minimal health concerns. But when you have catastrophic issues, cancer, kidney failure, how does that work, Mr. Juan? I'm going to call you Mr. Juan because I don't know your last name. How does that work?
Roger.
So
Okay,
let's say you get a bill
thank
every
you.
month. Let's say you get a bill every month for $12,000 for treatment. For whatever.
You pay nothing.
You pay nothing. And
Yeah, what
How does that
happens
work?
is your out-of-pocket maximum, the way it works is that your out-of-pocket maximum under the HMO is $8,100. And
Okay.
AvMed, between AvMed, okay, Transamerica pays the first $7,000, the HRA pays the next $1,100. That would cover your $8,100 out-of-pocket maximum. Now, for all your treatment, regardless of whether it's going to cost $1 million or $10 million, are covered at 100% for the balance of the calendar year. Once the calendar year resets, everything resets.
yeah, then you have to get the
Your
out of.
deductibles and your Transamerica. Excuse me?
I said that I understand that it resets itself on every calendar year. You're out of pocket.
Yes, yes. So, but on the catastrophic, that's where this plan excels over your current plan. Because under your current plan, under catastrophic, it would have cost you $2,500. Under the plan that we're proposing, under a catastrophic situation, you would pay zero.
Because of the gap
So
insurance.
this is much better for catastrophic
Is this because of the gap?
because of the gap in the HRA. Yes,
Okay,
yes.
okay.
Linda,
Thank-
is that satisfying for you? Is that answer satisfying for you?
So far, thank you.
Okay. So any other staff? Because it's
Thank you,
imperative
Linda.
you guys ask questions now. Any other staff have any other questions for Mr. Juan? You'll be forever known as Mr. Juan.
Mayor, staff members, and
Glenn,
council.
before he leaves, in terms of, we didn't go over drug benefit, and I'd like to talk about that because I spoke with my drug provider yesterday, and I said,
All right,
you,
Ben, hold on one second. We'll come back to you in a second. I just want to finish with the staff, and then we'll answer any questions. I'm not cutting the meeting off. But staff, do you have any other questions? Is everyone unmuted, Linda? I mean, Lisette?
I do have a question on tier 5 drugs.
Go on.
And drugs, let's say your doctor prescribes a drug that's not, it's like a tier 5 or tier 6. In your column, it says you have to pay retail. That's not the discounted price to the insurance company. Is that a true statement? Like you would have to, if the drug was $1,500, you'd be with the gap and pick up on that? Like a
Yeah,
drug?
okay, so the because you are a member of an insurance carrier, you're going to pay all the costs, all the services are going to be billed based on what the insurance carrier negotiates, not retail. So the retail is not accurate. I'm sorry.
Yeah, it's in the papers
all right,
here.
So it would be based on the negotiated price between AvMed for that prescription drug.
Okay, that's why I asked, because in the papers we have here, it says retail.
Okay, so before I go back to Ben, Vice Mayor Einstein, excuse me, does any other employees have any questions concerning this health insurance plan option? You said everyone's unmuted?
I have to ask to unmute, and then they have to unmute themselves. So I did ask everybody, but nobody's requested to unmute themselves.
Okay, so with that, I'm going to go back to Vice Mayor Einstein. You had a question? Can you answer?
Yeah,
Ask it again. I'm sorry.
I spoke to my pharmacy yesterday and asked, did they accept AvMed and could they accept AvMed? And this particular pharmacy said no. And he works at a Hollywood Memorial Hospital. He has an adjunct pharmacy within the hospital. I don't even know how it works. And he does delivery. And I've used him for the last 4 years, and the guy's been great. You call him up and I need this drug, I need that drug. He says, let me give you this one because United Healthcare isn't going to give you that. And somehow he manages to take his time and work out the drug coverage. And I've been very happy with it. And I think drug coverage is an item that we really didn't look at, because this is an item that most people, I know urgent care is a big ticket item, but a lot of people are going to have drug coverage. And I know we have this $1,800 card available or we're suggesting a number. Sorry, Alex. I don't know what that number is. That is going to cover some of that, I'm going to call it gap or whatever we want to call it. But the drug coverage, as I was looking at it, was in some cases more expensive under the AvMed program, from what I could understand. In worst case scenario was 50% of coinsurance, which I really didn't know. And for some of those who get medications, that can really be a big ticket item. It's an unknown, it could be.
Vice Mayor, if I can speak to that fact just real quick. Currently, our copays for tier 1 is 10, under AvMed is 15, for tier 2 is 35, for AvMed is 25, so it's less. For tier 3 is 60, with AvMed is 40. And by the way, United Healthcare does not cover a tier 4 medication. AvMed does. A tier 4 medication is $80. And don't forget, you're allowed to use your HRA card to cover your meds if you choose to do so, and if you have an allotment. So from an RX perspective, comparing AvMed plan to AvMed plan to United plan, the RX coverage is actually superior. And as a reminder, most pharmacies, Walgreens and others included, they also include delivery now as an option should you choose that option.
Juan, may I ask you a question in terms of the out-of-network? Okay, person needs to go to Mayo Clinic, MD Anderson, one of those. Currently under the plan as it states, there's no coverage for that, correct?
Okay, that's under the HMO. If you go under the point of service, then you would have access to the multi-plan network, which is known as, if you research multi-plan, many consider it the largest network. But you would have MD Anderson, Cleveland Clinic, all those are covered under the multi-plan. And there you would be paying $15 for primary care, $35 for a specialist.
But I'm yes. But I'm paying.
If you select the HMO, then you strictly have access to doctors and providers that are in the AvMed network. There's no out-of-network benefits there in that plan.
None at all.
In the
None at
HMO?
all.
In the HMO.
On the HMO. The only thing you have coverage for is you have emergency coverage worldwide, and you can go to a CVS in California, any CVS in California, and your prescription drugs are covered there. Same as any CVS in Louisiana. So you have pharmacy coverage on a national basis, and you have emergency coverage on a national basis. In fact, if you go to Yugoslavia and you have an emergency, you pay for it, you bring a receipt, and United and AvMed will reimburse you based on as if you would have had that emergency here in the States.
Is that based upon, and that's going to be with United Healthcare also, but again, Yugoslavia charged you $5,000. AvMed looks at it and they said, our usual and customary payment on that is $2,000. We don't have a contract with Yugoslavia. We are only going to pay you back, or we're going to pay them $2,000, and Yugoslavia is going to go against you for the $3,000.
All right.
Is that?
Bernard, AvMed wishes that we would be based on anyone's usual and customary reimbursements outside the U.S. Everybody's charges outside the U.S. are much less than they are here in the States, especially for an emergency room. But there is no, but first of all, for example, if you go on the high-end on the upgrade plan, your out-of-pocket's $250, which is covered by Transamerica. What they charge AvMed and so forth, that's not gonna. You're gonna be out of pocket $250. That's it.
Okay, guys. The other thing that I'd like to recommend, the other thing I'd like to recommend is some people may be bashful and shy and not want to ask a question online. So if you do have a question, the staff especially, please go see town manager and Lisette, and hopefully they'll be able to answer. With that, Alex, I'd like to, our objective is to see if we can get the council to, we're not voting on it, but just to go ahead with this, so then we can put it on the next agenda for approval, correct?
Correct, Mayor. So what I need from the council this morning is an indication as to where they stand, so that we can prepare an item for your ratification at the next council meeting, given the direction that you give me today. And again, my job is to present you options which we feel that we've done, and it's your job to set policy for the town.
Alex, may I ask a question, because we didn't throw this out, and because you have much more familiarity, and there's employees out here right now. Has any employees had problems with the United Healthcare plan? Have you had issues?
Sure. With every insurance carrier, we have to facilitate requests, drugs that are rejected, anesthesiologists that weren't covered but were charged through an outpatient center. And so all of the insurance brokers, like the League of Cities and others, there will be case-by-case scenarios where there are issues that arise, where we call and manage or strong arm the carrier to help us facilitate. And in the worst case scenario, the town has self-funded those hiccups throughout the course of my administration as the manager.
I mean, Linda's here and Lisette, I see them on the screen. I mean, they're employees and they've used United Healthcare in the past. Have you had issues? I mean, Lisette, I think you had a pregnancy with them and with United Healthcare. Yes, no, maybe. And you don't have to answer if you don't want to.
Yeah.
Yes. We did have United Healthcare, and I had no issues, and I didn't have to pay anything out of pocket.
And Linda, your husband had, again, I don't want to get into private.
Yes, he was in there for a while, running around. No, we have no issues with United Healthcare.
Mr. Vice Mayor, I can also comment on both. Currently with United, and also previously to have an AvMed. I was very happy with both.
Okay, so with that, guys, Alex, our objective is to, I guess, is Jaime still on?
Councilmember Mandel had to go off.
Okay, and Councilman Bernstein's not on.
Councilman Bernstein will be watching the recording, and he'll be speaking with myself and Juan upon him touching down from his current destination.
Okay, so it's kind of a moot point to take a straw vote, correct?
I'd like to get an idea of where I could do it offline. I could do that. I'll do it.
Yeah, why don't we do it offline? I don't want to put anyone on the spot.
That's right. I'll do it offline.
Why don't we do it offline? But Juan, I really appreciate your time and your effort. I think you've done a great job. And again, I urge the staff, if you have any concerns, because again, this is about you guys especially, that you go see the town manager, Lisette, and please tell us now. And don't, if you don't speak now, we'll never know. And fellow council members too, if you've got concerns, talk to the town manager and everything. But I think overall, looking at where we are financially with this plan and this option and the protective buy-up option, and with the gap insurance and the card that we're doing, I think it's pretty close to apples. Like I said before, every doctor's not going to be on it, but we had this issue, if you remember, when we switched to United a few years ago or 2 years ago, we had a problem with doctors not being on it initially also. So again, you're not going to please 100%, but I think overall it's a pretty solid plan. That's just my personal opinion. Everyone's entitled to theirs. But with that, if there's no more questions, town manager and staff and fellow council members, I'd like to call the meeting to end. Is that okay?
Yes.
Wait, Judy just came back. I don't mind giving my straw vote right now. I've got.
I'd rather do, Alex.
Yes, sir.
If we can do that, we could do a straw vote now, but two of the council members.
All it is a straw vote.
Right. All right. I'll start.
Okay.
I say this plan is sufficient for me and my family, and I'm on the plan, so it affects me as much as it does for everybody. But again, you've got to look out what's best for everybody, not just individuals. And I think this plan is a sufficient plan. I think the buy-up option and the Transamerican insurance, the gap insurance, and the extra pharmacy card and everything is sufficient for me and my family. So I vote yes. Vice Mayor?
Yeah, so looking at it all, first of all, I appreciate all the hard work that Alex has done and the staff has done. And for Mr. Beranger coming in this morning and explaining some of this information. I don't know if I totally have digested everything here. I just got the doctors that are on the plan. I want to see what the point of service program looks like. I am leaning right now towards staying with United Healthcare. I think there's just from the reputation of the two companies that I've heard, based upon the past performance of United Healthcare that I've had in the past. The doctors that are serviced on the plan that I've seen, I haven't heard from employees or anything concerning, this. I have had some background, unfortunately, concerning AvMed. They may have changed. I don't know, but I have had some things. I look at the AM Best ratings of the two companies, and one is significantly higher. And I think one of the most glittering things, I guess, is the Florida League of Cities. I feel like that is possibly the greatest impetus, is that there's tremendous clout in the numbers of the amount of cities that use United Healthcare. So all that being said, I know that there's increased costs with this, and I know there might be increased costs next year. And again, I think it's incumbent on us to deal with it next year and look at it. But at this point in time, I'm leaning towards the United Healthcare.
And one thing I do have to share with the council again, maybe I didn't make myself clear, is that the increase, and Alex, if I speak wrong about the numbers, correct me, but the increase for our stay on our existing policy is over $180,000. Okay.
111,000, sir.
How much what?
111,000.
All right, excuse me, 111,000. Okay. That's an increase. We just balanced our budget, so you understand that. And 111,000, we do not have extra in the budget, just so everyone understands. And this insurance affects me as much as it does Ben, Judy, Ken, and Councilman Mandel, everybody, and the staff, okay? But we do not have, so everyone understands, we do not have that money in the budget. So with that said, I'm sorry, Judy, you didn't vote. I'm sorry. If you can.
Councilmember Lustig is no longer on the call.
Okay. So it's just Councilman Vice Mayor Einstein and I?
Yes, sir.
Where did Judy go?
I'm not sure, sir.
Okay. So with that, I appreciate everyone's time and effort. We will have something for the next council meeting. Okay. Staff, I appreciate your time. Mr. Juan, I appreciate your time and effort. Town manager, I know you've been working the last 2 weeks on this, night and day, because you called me in the middle of the night.
The village of Key Biscayne, and look at all the referrals. There's plenty of counties.
Thank you, Juan. Thank you, Juan.
All right. Thank you. All right.
Okay. Guys, with that, I'll call the meeting 10. Thanks, guys.
Thank you.
Okay.